we're always looking for the new thing that might actually move the ball forward, if you will. And whether that is doing faith-based prisoner reentry work before it was quite so mainstream, or a whole host of other things you could point to, we've really focused on trying to find what's really working out there and helping to take it to scale.
Nurse Family Partnership is a evidence-based community health program designed to transform the lives of first-time vulnerable mothers and their children. We team a nurse with a mom and stay with her through the child's second birthday. There are very incredible results: improved birth outcomes for both the mom and the child, reductions in child abuse and neglect, improvements in school readiness. Public-private ventures provides a model for how this intervention can be taken to many more moms. We're involved in, frankly, daily dialogue and contact with them relative to communication about our sites and the challenges that we mutually face in replicating this very, very challenging and difficult work.
PPV fills a gap that I don't know of any other organization that does, in both bringing together programs that are of very high quality, but we all have needs, and none of us wants to reinvent the wheel. And when we can learn from a partner organization, that's absolutely the best way to do it, and again, the smartest way to do it. It just makes sense.
The Workforce Leaders Academy is a year-long peer learning community. We accept about 20 people a year from all different sectors working in the field of workforce development.
It provided a safe space for me to get together with several peers and for us to really help each other think through a lot of our issues on a day-to-day basis.
Because we think that innovation in the field is going to be driven by different perspectives coming together.
I think the Leadership Academy, if we could not just do it in New York, but in 20 cities in the United States and 5 in the UK, would be a real achievement.
We publish our work. We make it available. We actually publish it in a form that people like to read.
We read pretty much every report that PPV publishes. There's an excellence level there that is unmatched by many other publications in the field.
PPV's research is so in alignment with what the foundation does that when we access their information, it's really it's very easy to digest and very easy to inform our directions, our opinions, our approaches, our strategies. So it's been very helpful from that standpoint.
We do try to educate the policymakers in terms of what we've learned in the various fields where we work. We've had considerable traction and influence in the area of workforce development, particularly as it relates to people who have challenges to get in the labor market. The prisoner reentry work clearly is another area where we've had profound influence on public policy, most particularly the Second Chance Act, which is a piece of legislation that recently passed that essentially codifies the various components of the Ready for Work program. As we've engaged from White House to the Congress, both sides of the aisles, to the federal agencies, we've also clearly seen the need to then drill down and talk to states and local government. And we've done that, I think, pretty effectively, and we'll continue to expand that in the years to come.
I think that the independence of PPV is extraordinarily important in being able to be an influence to policymakers as well as service delivery providers in changing society. And the degree to which funders understand that PPV is not in any way co-opted by the funder or co-opted by the recipient of its work, like, for example, Big Brothers Big Sisters, and can remain independent, objective, analytical, at the same time mission-driven to change our country for the better around some of the serious social issues. I think that's an exciting role for PPV to play.